Hi everyone, welcome to Revising Dentistry. Today's episode is a different episode as we are discussing a topic which has never been discussed before. How to take over a dental practice. Who can be a better person to discuss about this? A member of a family who is very special in dentistry, Perio family. None other than Dr. Akshay Kumarswamy. Let's welcome him. Dr. Akshay Kumarswamy completed his BDS from the College of Dental Sciences, Davangere. Following that, he pursued his AEGD from Boston University, USA. Post that, he went for his master's degree in periodontics and implantology from University of North Carolina. After practicing for 10 years in USA, he decided to come back to India. Today we're going to talk about his process of taking over a 40-year-old practice which was run by his father and how did he do the transition. Let's welcome Dr. Akshay Kumarswamy. Dr. Akshay, welcome to the podcast.
Thank you so much, Jason.
I am sure that I've seen your 2 podcasts which are already online and there is amazing conversation coming from your end. I think even when I connected with you, I had opted for one of the same kind of similar lines I did ask you. But then you gave me such an amazing topic. So I don't think anyone has yet discussed this topic now.
Yeah, so the thing is, this was a topic which is close to me and my dad because we have gone through this transition recently.
Yes.
So, and I think this is something that we would like to share with everyone because a lot of younger dentists are, kind of itching to take over practices, open new practices. So I hope this podcast will help them answer all their questions that they have been having.
I'm sure. So today when we have a dentist group, I think everyone is aware of it. And we have a lot of advertisements coming in, that there is a sale of the practice, which is so and so years and so many years. And so that's like taking over a practice from a stranger. But I would really want to know that how did you and Dr. Kumarswamy, how did you have that transition and how it is to take over the practice which is already running and taking over from a relative, be it anyone, I would say, but taking over from a relative. So let's, discuss about it.
So I'll just go into a little background here.
Yeah.
So I was practicing in the US and stayed there for almost about 10 years. And in 2016, we decided we are going to come back to India, to Mumbai specifically. And at that time, I told my dad about it. And he said, okay, you're coming back. What is the plan once you come back? So I said, I guess come into the practice. And he's like, wait, the practice is already full with, with many dentists and we are working fine. So you may have to look at other things or you may have to take some time and then transition. So I said, that is fine. I'll start with consulting. So which is how once I came in, I started consulting, going into different places, doing perio implant surgeries. And then slowly once COVID came by, I started transitioning into the practice because, as we know, Dad got admitted to the hospital with COVID, recovered from it, thankfully. And during that time, I was in the clinic with Aparna, my wife. And once both of us started running it, then we said, okay, this should take a natural transition. So we discussed that with my father and we said, okay, we want to take over the practice. And then we said, we want to do it the legal way. Now, what is the legal? Yeah, the legal way is basically trying to ensure that both of the people who are in the practice are happy, because if you think about it, there's just one business, but there are at least 3 people who are earning out of it. So how do we ensure that it is fair to all of them? So we tried to do a kind of a practice analysis of how much the practice is worth, what is coming in, how we can divide that, how do we ensure that all 3 of us are happy with what is coming in to the practice. Okay. So that is when we encountered, we had a chartered accountant kind of help us out with getting the worth of the practice. Once we had that, we sat down, put pen to paper, got it done for the last 3 years. And then we finally decided that this should be a remuneration that should be going from me to my father so that I transition to practice and eventually take over the practice. So that was one part of it. Now, the other part of it was the real estate part, which, of course, he owned the real estate. And again, many people, of course, go into practices where they rent out the real estate. But here, he was owning the real estate. So then we decided that, of course, being in that place for almost about 30 years, that place was now getting smaller. So we wanted something bigger. So that is when Aparna and I started investing in another place, a bigger place. And then we got the real estate. We moved the clinic from there and then started this practice. And now, so we, of course, have our dad coming into the practice. He's, again, lowered his hours a bit. He comes about 3 or 4 times a week. When we do require him, he comes in. He's always there for us. But on that, it's Aparna and I who are managing the practice. And knock on wood, it's been going well for now.
Okay, great. So I think this just came out in a great statement, but I'm sure that when it happened, it must have been like a lot of things that came into consideration while the transition was happening. So how did the first conversation start between you and your father?
Right. So the first conversation when it started, in fact, my father said, okay, now that you're coming in, you have come back and you want to transition into the practice, we want to make sure that once the practice evaluation is done, the valuation of the practice is done, that you are happy with the amount that you will be paying me. Okay. So the first thing that he said is, let us sit down across the table with a chartered accountant in tow. And luckily, my uncle, that is his brother, is also a chartered accountant. So he also came into the picture. And all three of us sat down and said, okay, what is something that is comfortable for me and Aparna to give to my dad every month out of the collections that comes in, with which even he is happy and we are happy. So that is how we started talking about what it should be. Because in the end, what happens is most of the dentists in India, especially, and of his age group, their entire life's savings are into the practice.
Agreed.
So they are looking at cashing that out when they are looking at retirement. So they cannot just hand it over to their son or daughter and expect that, okay, fine, my daughter or son will just pay me, because we know how this world is. Later on, things may not go the right way. So that is when we said, okay, let us put it down legally on paper with an MOU, a memorandum of understanding between us, saying this is what it has to be. And we came into an agreement that over the years, as his involvement in the practice gets lesser, then my involvement gets more. Then, of course, the remuneration to him also keeps going lower and lower.
Agreed.
So that is how we started the conversation, and luckily it has been working out well till now.
Superb. So this valuation part that you said, like you had to include a chartered accountant into the picture. So while you're valuating a clinic or a practice, which is like, I mean, almost the practice would have been
40 years old.
40 years old. So putting out the valuation for a 40-year-old practice, how did they start, or what are the factors that were considered?
Now, one thing that a lot of us don't understand is the importance of goodwill in a practice. Okay, in any dental practice, goodwill holds the major chunk of the valuation of the practice, and unfortunately, that is something that is not tangible. It's called an intangible aspect of practice. So, roughly, they say about 80% of the practice is based on goodwill. It's only 20% is the remaining, the paraphernalia, your real estate and all of that. Otherwise, 80% is just goodwill, because if that doctor moves out, he moves out with his goodwill. So that is very important, but unfortunately an intangible aspect of practice valuation. So when we sat down, we took the collections of the clinic for the past 3 to 4 years, saw what was the ITR returns, the profits made and all of that, and then decided how we should come about. And again, chartered accountants are very good at this. They have these valuation models that they have. They have different models for practice valuations.
Okay.
Again, they use business valuation models, but again, it applies to a practice as well, albeit on a lower scale, a smaller scale. But that is how we came into a number saying, okay, the practice is worth, let's say, 5 CR or 6 CR. How can the dentist, the senior dentist, get that out of the practice? Okay, either it can be a straight buyout if the new person has the money and the wherewithal to buy it out, or it has to be in a staggered process. So those are the things that we came up with, and that is where the chartered accountant helped us with.
Okay. So as you said that the goodwill is the most intangible part of it. And I mean, even the patients that were like, visiting, because there was no pause in between. So how did that transition happen? Like, how did that go on with it?
So in fact, even now it happens. So many a times a patient will call up and say, I want an appointment with Dr. Kumarswamy. And funnily enough, I was Dr. Kumarswamy in the US because they always refer to you by the last name there. So I was always Dr. Kumarswamy. So we told the front desk that if somebody asks, they want an appointment, let them come in and we'll take a look at it. For the first few months, the patients were in shock. Oh, you're going to see me? I thought I was being seen by your father. I said, no, my dad is not well. And this was during the transition period. He's not well. But again, if in case there is something that he needs to be seen, I'll make sure that he comes and sees you, but I can take care of it. So it happened on a slow basis, the transition aspect of it. People were a bit surprised, but then as they kept coming into the practice, as they kept seeing Aparna and I in the clinic, then they got pretty much comfortable. Nowadays, what happens is dad comes in and he's more of a public relations person.
Okay.
So not that he's retired, he still
Yeah.
comes in and does surgeries, implant surgeries, impactions and all of that. But one of his main jobs is, of course, to sit, greet patients. They love talking to him, but they'll get the work done with me or Aparna. So that is a big advantage that we have when they are just happy seeing him there. They have that confidence, and then they can get the work done with us. Of course, there are some patients who insist on being seen by him, and we have no qualms about that. We let them know that dad is there only on certain days. So if they want to come in, they can come and see him. If there's an emergency, then we can take care of it. So so that I think the patients are right now are kind of happy with the transition that is taking place. Initially, it was a shock for them.
Okay. So as you said that the valuation was done, like supposingly we say take an amount of a 3 CR. So right now, if you don't have that much amount, because as a beginner, if I'm taking over some kind of practice, I may not have that kind of chunk. So how can I, if I want to take over a practice which is say 40-year-old practice and that person is not known to me, so what are important aspects during that time? Like how can I take over the practice in that scenario?
So what happens many times is, of course, for a non-dentist, let's say a son or a daughter, and they want to buy into a practice. Unfortunately, in India, what happens, dentistry for banks is not considered a business where they can give a loan. Okay. Many times in the US, they actually go about valuating a practice and they can give you the entire amount to buy out a practice. In India, they consider a real estate as a part of the business, as a part of the practice, but the practice per se, they will not give you because they don't have any collateral. So the banks are very wary about not giving loans without any collaterals, as we know. So many times, again, there has to be some help either from their parents in trying to get that chunk of money. That would be one. It's like buying into or investing into a long-term aspect of it. Many times I have also seen spouses get married, both of them put their savings into buying into a practice. The third scenario is where they start working with that senior dentist for a longer period of time. So this is where a contract becomes essential. Now, this has to be from both ends. The person who is trying to sell the practice has to be happy with the one who's entering, and the person who's entering has to be happy with the person who is selling. As long as it is a contract on a legal document, ensuring that there's all legality that is followed, it can always turn a little nasty. So basically what happens in the long run is this person works for that person, okay, for the senior dentist, for let's say a period of 10 years and says, over the next 10 years, you're going to pay me my part slowly and steadily. Because when you think about buying out a practice, I remember I told you goodwill forms a major basis. You actually cannot buy out a practice and have the senior dentist exit the next day because you lose all your patients. What's to say that dentist is not going to open a clinic nearby and take all the patients away? Exactly. So that is why there has to be a transition. So one of the best ways to do is to identify a senior dentist who is willing to mentor you, number one, and willing to sell you the practice. And you have to give that long-term commitment of staying there, let's say for maybe 5 years, 10 years. This is something that has to be decided between both the senior dentist and the one who's buying. And slowly, every year, he keeps paying a little bit from the collections to that senior dentist, who also has a steady flow of income. And then one fine day, they say, okay, once I reach this amount or once we reach this amount of years, then we'll automatically transition to the practice to the younger person.
Okay. So if supposing I start practicing with him in that duration, do I get paid as a salary person or do I get a percentage from the amount of patients that I'm doing?
Collection. Good question. So it can be either ways.
Okay.
It can be either ways. It can be a salary at first. So let's say if I am employing someone, I do not know the potential of that person. I do not know whether I'm going to be happy selling my practice to them. Now, if you think about it from the perspective of the senior dentist, it's their baby.
Yes.
They have nurtured this for the past 40 years, raised it, and suddenly they're like, okay, we have to sell the practice. It becomes difficult for them.
Yeah.
So that is when they have to ensure that the person coming in, they are happy with them. So what they do is they have it, check them out, see how they work, okay? And then if they are happy, they can always change it from a salary to a percentage basis.
Okay.
Okay. I don't think on day one itself that decision can be made that, you know what, I'm going to buy unless the dentist is so old that he's like, I cannot practice, I'm going to sell the practice. That is a different scenario altogether, where let's say I'll just put an age, 80, 85-year-old dentist who's been, practicing dentistry, and finally, of course, their kids are not dentists, and says, I have no idea what to do with my practice. Some young guy comes in like, I'm going to buy your practice out. Most of the time what happens is they end up selling the real estate.
Okay.
The goodwill aspect is completely lost, because by the time you're, let's say, 80, I don't think patients would want to go to an 80-year-old dentist.
Agreed.
Right? Patients are like, okay, you know what? I think I'll go to somebody younger. So he's already lost that goodwill over the years. Okay. So me and my dad were discussing about this aspect that dentists of my dad's age, and of course those who hopefully will listen to this podcast, have to make that decision of when to transition much earlier than later. Because if they keep it too late, they have lost the goodwill, the value of the practice comes down. So that is one thing which they have, because many times, as we have seen, senior dentists, they'll keep working fine. They'll employ someone, but they do not find that person to be the right person. They're losing out on time. Yeah. Patients are slowly exiting the practice because they're like, senior doctor to kaam nahi kar rahe hain, mere ko junior se kaam karana nahi hai. And then slowly it becomes that they have to just shut shop and just sell the real estate. So they have lost out on that goodwill aspect.
Okay.
So that is why that transition has to be very important between both the senior dentist and the junior dentist.
So preparing, preparation from that senior practitioner as well is very important. Very important aspect.
Yeah, very important, because again, as I said, you cannot be too late.
Yeah.
If you're too late, the business model goes down. And it's like, if I can give you a simple scenario of innovation, okay, there are so many of these businesses that have not innovated over the years and have just gone.
Yeah.
Like, for example, Kodak being one of the main things.
Yes.
They never went into digital cameras.
Yes.
And they just lost out and the business closed down. And we can agree that a lot of the senior dentists, they have the mindset of, "Arey, mera aur kitna saal baki hai practice mein? Why should I invest in new gadgetry?" And patients realize that. Patients come to the, in an instant, and they're like, you know what, I want to go somewhere else. I want to go somewhere where there is newer technologies that are being established, the newer technologies that are being used. So automatically the patient flow decreases. So they have to try and transition/sell that practice when it's at its peak, while they are still active, so that they can help transition the patients into the new practice.
Okay. So even the treatment planning part, I would rather say here, that when and no two people can have same minds, so, or same kind of practice, or same way to practice. Okay. So if my way of practice and the senior practitioner's way of practice are different, so does that require a conversation as well, just before starting the practice together?
Yes, and that also depends on how much involvement in technology the senior person has. For example, there may be a dentist who has not done implants at all. He's comfortable doing bridges. Then we have the young gun coming in and said, you know what, I have trained in implants, I have done a course, I'm going to place an implant here. And the senior dentist is like, oh, no, why? Bridges have worked for me. Yeah. So this is something where it has to be spoken about right before the transition takes place, or right before even employing that person into the practice. So most of these starts with associates. Basically, the dentist is hired as an associate. Coming back to your original question about whether they should, get a percentage, or most of it should start off as an associate. And then the senior dentist can mentor or groom the associate into the next step, which is partnership or ownership of the practice. Okay. So it always has to be like that. So there will be a clash of treatment ideas. There is a clash even now with me and my dad when it comes to treatment ideas. I may think about grafting a case. He may think about doing it in a non-grafting way, graftless way, and all of that. But again, so there has to be a middle ground that has to be brought about. Newer things are coming in. They are working. So that is something which both the practitioners have to sit down, and the senior dentist has to understand the aspect of newer technologies, and the newer dentist has to understand the importance of experience. Okay. Because there are things that may not work, which the senior dentist will identify, especially if the patient is an old patient of his. He may very well say, you know what, I don't think this treatment will work in her. Just go back to whatever you've been doing.
Yeah.
So that is something that both of them have to have an open mind to have a discussion about treatment.
And I think that energy should not be emitted to the patient as well, that there is a controversy or there is a discussion going on regarding my treatment only. And that energy should not be emitted to the patients as well. So I think...
At no point, yes.
Yeah. So it's better to keep it behind the doors where the patient is already seated.
Correct. So again, what we do is, of course, we see a patient, we go in and take a look at what the patient needs, and come out of the room and then discuss the treatment plan, and then go in again and present the treatment plan. Okay. Many times, of course, what my father does is he sees the patient, kind of advises the treatment to the patient, and then he lets me and Aparna go in and explain it to the patient. So he doesn't do the explanation. He says, okay, this is what you need. And then we get a chance to interact with the patient. Wow. So that becomes important as well. So for senior dentists, all they need to do is just explain or tell what treatment is needed. Let the junior dentist come in, explain the treatment scenarios, the cost, treatment, answer the questions, everything. And there's always any doubt if the patient has, the senior dentist can always come in to answer those questions again.
So that even the patient is familiar with both the faces and all the faces that are going to treat treat them.
Right.
Perfect. So now getting into the legal aspect of it, as you said that you had a written MOU done.
Correct.
So do you take an advocate into the picture, or how did you go ahead with that?
So we took the help, of course, of our chartered accountant,
Yes.
and they have done this a lot in terms of what kind of legal paper has to be there, what stamp paper it has to be written, and all of that. So contracts have to be between the two people, just like any other contract that is there. The contract has to mention in specific terms what it is for, how many years it is going to be, what are the remuneration, everything. I mean, it has to be very clear. There should be no ambiguity in that contract, because what happens is, let's say if that is missing, then as I gave you the scenario earlier, what stops the senior dentist from going somewhere and opening a practice and taking all the patients away with him? So that is the reason why a watertight contract is very, very important in these, which has a lot of clauses, non-compete clause, which again prevents either dentist from opening up a practice close by if they have to exit the practice, and a lot of other as legal things that have to come on paper before this is going in. And again, as I said, this may not happen initially. If in case this new dentist is joining in as associate, they probably will see this happen over the next 2 to 3 years. Once the senior dentist is happy and thinks of them as a potential successor to their practice, then they may say, okay, you know what, let us get into a legal contract. And either they start off with a partnership where the junior dentist also is putting in some money into the practice. Let's say they want to expand, they want to get a new chair. The senior dentist may not want to put that money. The junior dentist is putting his money into the practice. Okay. So that kind of a partnership. Eventually that partnership can then change into an ownership.
Okay.
So there are different modalities and scenarios that it can take place step by step for it to completely transition from the senior dentist to the junior dentist.
Okay. So now going ahead from here, like how is staff, when the staff comes into the picture, so what aspects are important in that scenario?
Right. Now, see, retention of staff is very, very important. Many a times I have seen scenarios where a junior dentist gets bugged that the senior dental assistant is telling them what to do.
Agreed.
Right?
It happens a lot.
It happens a lot. But to be fair to them, they actually have seen more of the practice than the junior dentist. Okay, so so that experience matters. And my mom always keeps saying that an experienced patient is much more valuable than a new dentist or a new doctor. Okay,
Agreed.
or a doctor or dentist. So same thing here. A dental assistant probably who has been in the practice for a long time has seen a lot of scenarios where, and again, they probably are not doing it on purpose. By mistake, it may come out of their mouth saying, "Oh, maybe you should do this or do that." But that is something that a junior dentist has to take with a pinch of salt, because again, they are talking with somebody who has been there. Now, talking about transition of these auxiliary staff, as we call them, that is also something that can be transitioned. So let's say, for example, a assistant is there who has been with the senior doctor for almost about 30 years. Now, let's be honest, they are also getting old. Okay, so they also need to be transitioned out. So if that is the case, then there has to be some understanding with the senior dentist. And again, the junior dentist cannot tell the senior dentist saying, I want them out. That is something the senior dentist has to realize, that if I'm transitioning out, they may also have to transition out. So that is a conversation between both of them. But the junior dentist can always let them know, saying that I may want to transition them, or I want to bring my own staff or hire new staff. So that is something that has to be there. If there are younger people who are experienced enough, then that transition has to be there as well. They have to ensure that they are good enough to stay on there and make sure that they stay on along with the new person who's coming in, because many times personalities will clash. True. So that is something where the new dentist may not want that old assistant to be there. True. But again, if they are a good person, you may have to kind of hunch down and say, okay, you know what, I'll try to see how we can work it out with them.
Okay. So, as you said, like, communication plays a very important role, be it between the dentists, be it between the staff and the dentist, and be it between the new dentist taking over and the old staff as well. So, communication is a very important key, and that sets the ground rules, I guess.
Correct.
Going ahead for the marketing part, like, nowadays marketing is happening in a lot of different ways. Now, how do I convey my patients, or how do I convey the senior practitioners' patients that I'm taking over the practice?
Correct. So this is something which a new dentist may not have as much of a role as much as the senior dentist has.
Okay.
Because the senior dentist has to tell their patient saying, you know what, I am transitioning the practice to this young man or young woman right here. So why don't you meet them? And I have extreme confidence in their abilities. That just one word or one sentence is enough to convince the patient that yes, they are in safe hands, or they have a continuing care that is going on. That continuation of care is very, very important, because that is where patients can be lost. Let's say the senior dentist is not interested. And again, coming back to how we spoke about having everything on legal paper and legalities. If the senior dentist decides one day that they're going to walk out of the practice, and that one day is probably just 1 month into the new person's coming in, they have lost all the goodwill. That is the reason why when we talk about getting it on paper, there has to be what is called as an overlap period. The senior dentist has to be there for an overlap while the junior dentist is taking over. That overlap period can be anywhere from 5 years to 10 years.
Wow.
Okay.
Wow.
That's a serious overlap that has to be there. Now, many times that point is decided between the two people. Okay. Sometimes 10 years may be too much. Okay. And I'll tell you the reason why. The senior dentists, as I said, have put their heart and soul into that practice. You cannot take it away from them in a jiffy.
True.
They'll keep coming back. But there has to be a finality. There has to be a time when they have to say, okay, you know what, I'm going to step back and let the young person take over because I have sold the practice to them. So that is, and the other aspect that comes into here is, if you think about dentists, we invest all our lives only in dentistry. We have very little to do other than dentistry.
I agree.
So it's very important to do other things so that you can keep your mind away. And I am happy looking at my dad now. You know, he's singing, he's learning the piano, he's doing so many different things that keeps him busy. So there are times when I have to pull him into the clinic saying, this patient really needs to see you. You need to come back in. You know, so that is very important. So it's very difficult to pull them away from practice if dentistry is the only thing they've been doing all their life.
True.
So that putting it on paper in terms of, trying to transition becomes an important aspect where the exit has to be mutually agreed upon.
Yeah.
But it cannot be too short or it can be too long.
Cannot be too long.
So it's a sweet spot between the two where the transition takes place.
How many years did you take? Like, what was the transition period for you?
So right now we are still in the transition period.
Okay.
Yeah. So our transition period we agreed was almost about 10 years, 10 to 12 years is what we have agreed upon.
Okay.
Where I think every 3 or 5 years is what we've decided. His number of hours keeps coming down. Okay. So, and my hours keep going up. Because I, of course, started doing a lot of consulting outside. I have slowly decreased that. So that's almost come to nothing right now. I'm in the clinic most of the time. So that is the transition that has to take place. Now, many junior dentists may keep thinking that, okay, if I get into the practice, how will I ensure that I'm busy? So they also may have to think about working somewhere else, gaining some experience while they are buying into this practice.
Okay. Oh, even that is an option.
That's an option. They may want to come half day here, and work half day somewhere else because they have invested here. But again, they're putting money here into buying the practice, but they may not be getting something out to live a life. So they may have to work somewhere else to live that life and maybe fund this practice as well. So a lot of funding scenarios. Let's say, a lot of funding scenarios are there where they have to, if they are buying into the practice and the practice value is very high, they may have to work at multiple places to try and earn that money to come here, pay that and get the practice and eventually transition over. So that is also a scenario that happens where I've seen people who work part-time in other places and part-time here. And let's say the senior dentist is there during that time, they help transition. So that is also one. Coming back to your question about how do they market. So as I said, one is introducing the new dentist to the patient, number one. Number two is out in the social world. I mean, when I say social world, I'm not talking about social media. I'm talking about just the regular world outside. They get involved in social organizations, let's say a Lions Club or Rotary Club, the local gymkhana or the local sports club. So all of those are areas where they can go in and market themselves, and they can ask the senior dentist which social clubs they are part of, and then go in there and get them transitioned from there. Okay. Another thing would be the local area. If they are practicing in a suburban area where they have a lot of houses close by, a lot of buildings close by, start conducting camps. Start conducting camps with the name of the senior dentist, of course. Okay, and that is one way of letting them know that this practice now is being transitioned into this new person. So that is very important. Of course, social media is always there. You have to put it on social media as well. Let's say Google My Business or an Instagram or any of that is also important in conveying that the practice is being transitioned. But nothing to beat word of mouth. I mean, at the end of the day, a patient who comes in, sees a new face, sees the old face, sees them together, will go out and say, oh, you know what, the practice is being transitioned. I got worked upon by the younger person and he's good. And that will go a long way in ensuring that the practice is taking a good transition.
As in the word of mouth itself in our general practice or while transitioning, word of mouth still holds the bigger bigger part, and it is unbeatable. I mean, any kind of social media, yes, they are the newer technologies, but word of mouth, I don't think nothing has beaten it yet.
True.
Because the patients that come in with the word of mouth are the definite and sure shot that they'll start with the treatment with you.
Yes, and again, both you and me can attest to the fact that we get patients from far and wide. Okay, it's not just local. Let's say if I'm practicing Chembur, I probably may not have as many patients in Chembur as may I have from other areas, because these patients will call up saying, oh, my dentist is good, why don't you come here? And I've had people come far off from, let's say, Mira Road and everywhere, and I feel bad for them. I said, you know what, I can try and advise and suggest somebody closer to you, but I really feel bad that you're coming all the way. But it's a trust. At the end of the day, it's all trust that matters, and the patient wants that trust. And if they hear it from a friend saying that dentist is good, they'll travel all the way to come and see you.
Wow.
So that word of mouth is really, really important.
Wow.
I don't think anything can replace that.
True. So as a dentist, currently, even for a new dentist, the settling period, or that we used to say that we have settled in our practice, that duration has elongated
Increased.
a lot, which initially used to be 3 years or 5 years.
Correct.
Now it has come to probably 10 years, where the trust factor has come in. So for a newer dentist, if they are transitioning into the practice, which is old, is the duration same enough? How does it work in that?
So I don't think the duration is that long then. It then becomes short. But if you think, so there are 2 points here. One is the professional aspect of it, and one is a personal aspect. Now, personally speaking, this dentist may have graduated from dental school, let's say at the age of 22 or 23. Okay, they have decided not to do an MDS. They have decided straight on to go into practice, and they're working at different places as an associate or something. After about 5 or 6 years, they say, okay, now I want to buy into a practice. Okay, then they start transitioning into that. So if you see, they've already done about 5 years of dentistry, then they go into buying a practice. That transition period becomes shorter for them. Okay, because it's an already established clinic. So the senior dentist is already established. There's good word of mouth that is going around. There is also a goodwill that is there. So that transition period becomes small. The fact that we speak about how the transition period has increased for newer dentists is when they open their own practice at a new place or an entirely new practice without transitioning or without not entering into a senior's practice. So that becomes a little difficult. And I still think that newer dentists should look at buying into or transitioning into practices of senior dentists rather than trying to open their own practice, because there are a lot of dentists who are there. A lot of them, let's say, may not go the retirement way. They may just move places. They may not want to stay in Bombay anymore. They may want to go somewhere else. That's the practice that they want to sell. So a good amount of research is very, very important. Nowadays, what happens, a lot of them are just about going and opening new practices in a fancy new place with fancy new gadgetry and fancy interiors. But there's no footfall. So that aspect of it can be curtailed if they are transitioning into a practice that has already been established. And let's say even that practice that they're going into is just about 2 or 3 years old. Even that much of goodwill is good enough to get them started. Okay, rather than completely opening a new practice. Now, that scenario can be different for somebody whose, let's say, family is very active in the social circles. Okay, nowadays it's very difficult to say there are no dentists in the family, because each and every family has a dentist, right? So very difficult for that scenario to happen. But if the family social circle is very active, they have a stream of patients from day one, then yes, no qualms in opening up a new practice altogether. But other than that, I still feel a new dentist coming out of dental school should start gaining experience by joining a senior's practice. And then if they are lucky, if the senior dentist thinks they are good, can transition into an associateship, partnership, and then ownership.
Okay, okay. So here, when I think if there is a shorter duration of practice that is going on, like, as if I want to take over a practice which is a 3-year-old or a 5-year-old practice. So here, I think the goodwill part will not be that much of value.
Correct.
So here, what are the other aspects that come into the picture?
Correct. So the other aspects is, now we also have to think about the personality of this dentist who is selling the practice. Okay. As we discussed before, the two personalities need to match. Okay. Otherwise, it's going to be very difficult. Also, the fact that needs to be checked out is if it's the kind of practice that the junior dentist wants to go into. A lot of them, and you will agree, saying there is two types of practices.
Yes.
One is mass, one is class.
Yes.
Okay. Senior dentist may be running a mass practice. The junior dentist is not at all interested in mass, they want class practice. That transition is going to be difficult. So that is a transition that has to take place, where the senior dentist probably has to exit sooner so that the junior dentist can convert it into a class practice. Because what happens, the goodwill automatically will go down when that mass converts into a class. Okay. Patients coming in into a mass practice, we know how that works. Patients are sitting outside, one gets injected, waits while the second one comes in. And the junior dentist is like, wait, this is not what I envisioned. I want to spend time with each of my patients. I want to ensure that my treatment is done. But if he starts doing it sooner, the patients who are waiting outside go out and say, "Arey, nahi, wo dentist se bhi acha nahi." That kind of a, and once that word sticks,
it's difficult. I think if you vision yourself doing a class practice, might as well go ahead with a class practice which is in the
correct. Yes, you identify somebody who is, so that becomes very important. And again, I said that identification is very important from both sides. Identification from the senior dentist to ensure that the person who are getting in is somebody who aligns with their practice philosophy. Same thing for the junior dentist. Their practice philosophy should align with the practice that they're entering into. So that becomes very important.
That's one of the point which is very important before you go in. Perfect. So now, what do you see, like what is your vision that is completely different from the senior practitioners, this thing? So then when can you start completely, like if that 10 years have passed away, supposedly, can you do can you change the practice overnight and make it a completely different?
So overnight would be very difficult because you don't want to shock the patients. Okay, that has to be a transition. Again, as I said, the participation from the senior dentist as the time increases keeps on getting less and less. So as we near, let's say, the 8 or 9 year mark, where the junior dentist says, you know what, I want to change the things because they are now almost a majority stake owner holder in that practice. I want to get a new chair. Fine, he's putting in the money. The senior dentist is not putting any money. So that's a decision that they have to take. I want to buy a new scanner, or I want to put an OPG machine or a CBCT machine. Yes, go ahead. He's going to put in the money and going to do that. So I don't think that will matter as much as the practice is gained that amount of time. In the initial periods, yes, it is going to be a hassle. So that is when in the initial period, I probably will not go and ask the younger dentist to do major changes. But as time increases, it has to be done. I mean, remaining stagnant is not an option at all. And I have seen, clinics where the son or the daughter have taken over from their father, and the practice still looks like when the father started their practice because they have not transitioned. The reason being, they're like, we are happy the way it's working. Why should we change? But that's not the world works, I mean, you have to have change. So if you walk into the practice, and this was one practice, I won't name them. This was one practice I went consulting, and their father was a dentist in the early 70s and 80s, and they took over in the 90s. The practice still looks stuck in the 90s. I mean, you still have those swivel chairs for the dentist and the old time chairs, and so that aspect is something that one should be aware of when they are transitioning. They should not just be lazy enough to say, "Jaise chal raha waise chalne do." That is not going to work. They have to remain at the forefront of technology, have to remain at the forefront of the changes that are happening in dentistry, and make sure they make those changes in time. Otherwise, they'll be left behind in the rat race.
What are the positive and as well as the negative aspects in when you take over a practice from a family member, be it from a father or be it from mother? How does that work out even with the dental fraternity?
Correct.
Yeah.
So again, one of the first things that people outside of our family, probably must be thinking is, oh, he has it easy for him.
Yes.
Everything has been set up and he has it easy, whereas it's completely opposite of that. I mean, right from gaining the patient's trust, number one, to ensuring that you maintain the same quality of work that has been given. So that is something that is very, very important, and that is a struggle for anybody that is, starting off. Also, the fact that the disappointment when the patient looks at you and says, "Ah, I think I'll prefer your father,"
It pinches you.
Yes, it pinches you. But you know that when you think about it from the patient's point of view, you know that they have trusted somebody and they would not want any of that trust to be broken by somebody new. I mean, if I were going to some senior doctor and suddenly I see a new face, I would be shocked. I would be like, no, I want to see that person, that kind of a thing. So that is somewhat which has to be built over time. And as I mentioned before, it has to be from both sides, where the senior dentist is helping the junior by introducing the patient, by letting them do small work, and which is what our dad did. He let us start with some prophies on some patient, then it eventually went into fillings, then implants. So now the patients are comfortable enough. So it has to be a transition. It cannot be a complete changeover on day one. So that is one thing. The positive aspect, of course, is the goodwill. The goodwill that comes along, there is nothing to beat it. I mean, patients are coming in, they have known, that they have a son. And what has happened is the senior dentist, the father, has been constantly, the father or the mother has been constantly telling the patients, saying, oh, you know what, my son is or daughter is going to join me in the practice. So the patients are aware. They know what to look forward to.
Even before getting introduced.
Exactly. Even before they walk into the practice, there has been a scenario that has been created, a hype that has been created, saying, my son or daughter is going to come into the practice and they are going to help me out. So then the patients are also happy about that aspect. So that is one very positive thing that certainly helps. Now, many times when I talk about this one-on-one with a lot of younger dentists, same thing. In their mind, they're like, "Arey, he's lucky, he has a practice."
Second generation.
Second generation or nepo kid or whatever you may call it. Whatever you may call it.
I think nepotism has got a very negative impact to the word.
Exactly. But no, it's a struggle. I mean, to try and build up and come up to that level of practice. And let's be honest, whenever a practice transition takes place, be it from a father to a son, mother, daughter, whatever the scenario, or from a senior dentist to nobody from the family, somebody else, there will be almost about a 20% loss of patients. That is a given. Okay, not all of your patients are going to come back. Okay, so there's always a erosion of almost about 20% of the patient. But the good thing is there are 20% new patients who are going to come in. So that is always a good thing that you should look forward to. Same thing happens with an area change. Now we did that. For example, our old clinic was about 5 minutes from where we are right now. And our old clinic was on the ground floor. Currently, we are on the second floor. The number one question that people asked, oh, you're on the second floor, how will you get footfalls? And we said, after 40 years of practice, we don't want the footfalls that we don't want the walk-ins. We work by appointments. We work only by phone calls. So we are okay with that. But that is something that patients have to get used to. They're like, Doctor Sahab, bahar itna acha board tha, and here they come in and they're like, board dikh raha nahi hai kahin bahar. You're like, board nahi, aapke paas number hai? Aa jayenge. So that is a big thing that is sometimes going to happen. But yes, if you are going to change the area, expect some amount of erosion from the practice. All the patients are not going to come to you, and that is okay. That is okay. Your patients who trust you will still come to you. Okay, the remaining 20% who did not come, maybe you also do not want them.
Agreed.
So there'll be a new set of patients coming in from the newer area that you have moved into.
True.
That is something that should not worry people when they are moving into another area. So that would be a kind of a negative/positive of practice transition.
Yeah, and transitioning from a ground floor to a second floor, transitioning from a newer area altogether, newer city, everything has its kind of this thing. But there will be some patients that they'll come no matter where you go, and there'll be some who will be not coming to you even if you shift like a floor or a shop besides it, something like that.
Yes. In fact, just yesterday we were discussing, and before coming, I was telling my dad I'm coming to this podcast, and we were discussing about how this one dentist who came from, I think, somewhere interior Madhya Pradesh or Rajasthan into Bombay as soon as he finished dentistry with a mindset saying, "Mujhe practice to Mumbai mein karna hai." He came in, and this was in the 90s, came in, established himself closer to somewhere in Matunga or Sion, and over the years has done well enough now that the son is also getting has got into dentistry and doing well. So, those are the trailblazers, as we call them, who made that decision to move away from a tier 2 city into a tier 1 city with no backing at all. And what they did was they started working with a senior dentist. And once they gained amount of experience, then they opened up a clinic close by or far away, wherever they are, and started their practice. So I think that, grit and gumption is very, very important to be open enough and be confident enough to open a practice in a completely new city. But again, that is when you get yourself completely into the world out there. Ensure you meet a lot of people
Yeah.
outside the dentistry world to make sure that people come into your practice.
True. So here I would just create a scenario and ask you a question where if supposingly I'm already in the transition period and the senior practitioner who's not known to me did not mention about anyone getting into dentistry from their family. But all of a sudden, after a few years, they have someone popping up.
Correct.
That, the dentist is going to come.
Yes.
So now from here on, like, what will be the scenario for the dentist who's investing into it?
Good question. Which is why I said at starting itself that it has to be legal on paper. Okay. When it's legally on paper, then yes, the transition, even if somebody comes in, it's already on paper that they have understood that this transition is going to take place. It's not going to happen, or they can, of course, take them to court and fight it out in court. Okay, that is one thing. Or a settlement, as they call it, has to be done. Now, for the younger person coming into the practice, if they are seeing that somebody is already transitioning into the practice, they need to have a conversation with that senior dentist saying, you know what, I want to come into the practice. What have you done? And the senior dentist was like, I'm sorry, but I've already signed this contract. So that what you can do is open up a practice. But that is where it becomes tricky. Because if this senior dentist is going to that practice as well to help out that, then this person is losing out. That is why a non-compete clause is very important. A non-compete clause basically tells you that if you are in this practice, you cannot open or practice anywhere in a radius of about 2 to 5 kilometers, depending on both of them deciding what it should be. But usually it's about 2 kilometers radius. And that will help in limiting the heartbreak that can happen with the senior dentist going somewhere and practicing. So that non-compete clause is very, very important aspect. Nowadays, a lot of people are having non-compete clauses with associates as well. Okay, let's say they don't want to sell the practice, but they have an associate. What's to stop the associate from opening a clinic next door and taking all the patients? So, which is why having a contract with an associate is very important, especially with so many dentists now coming in. You have to have that non-compete clause with them that they cannot open a practice within the 2-kilometer radius. And then beyond that, again, that comes out of the legality. They can't do much about it. If the patients are really traveling, then maybe they didn't like you at all.
Okay.
Right? They like the other person who is practicing somewhere else.
Yeah.
But all of that. I keep coming back to the legal aspects of it.
Yes.
Very important. And that is a little weak, I feel, in India, where in dentistry, everything works by, "Arey haan, maine bol diya to chal jayega." No. Has to be on paper. Everything has to be specified so that there are no, bad taste in the mouth between those two people as time keeps going on.
So, just a few legal aspects that in a practice we should have, apart from transitioning and everything. When it comes to the patient, certain legal aspects that you've inculcated in your practice.
So again, number one would be consent forms. Consent forms is very, very important. Before any treatment is done, ensure that there is a consent form that is signed by the patient explaining all the details of what treatment you are going to do for that patient. So that becomes number one. The number two aspect would be ensuring that the patient see, many times people ask for reviews. Okay. And the patient goes and ends up being a bad review. And then everything goes to hell. I mean, that is something that is not ideal. So many times what they can do is ask the patient verbally as to how it is and is there anything that they could do better, and try to solve it before it goes into the legal point of view. So that is very important, to have an open conversation. Many times I feel that a new dentist should learn how to talk to patients. That soft skills is very, very important. That is because let's agree, we have all graduated from colleges where we just did our work for completion of the quota, would not even talk to the patient, walk away. Okay. And I have seen the exact opposite in the US where I taught. Patients were given for comprehensive care, and now that is changing in India as well. Savita Dental College is one college where students are treating patients in a comprehensive way, which means if the patient walks in, that one dentist is responsible, or that one student is responsible for taking care of all their needs with that patient. So there's no change of hands. There are no going to that department, going to this time. No, all of that. So that comprehensive care model has to be, kind of envisioned all over the country and that gives a lot of soft skills. Because what happens is you develop a relationship with that patient over time. So those soft skills are very important to learn, to ensure that you know how to talk to patients and understand from them. That will also bring down the amount of negativity and bad reviews from patient towards your practice. So that soft skills is very important. But other than that, I think in terms of what other legal things have to have, it's
with the patient, it probably is just the consent forms as much. I would not think about anything else. But yes, with the senior practitioner, there are a lot of other things which we discussed.
Okay. So I think we come to an end to this podcast. So anything like, you want to add or just end the podcast with?
So the one thing that I would ask all the young dentists to do is try to find a mentor. Very, very important to try and find a mentor who can mentor you as you progress through your dental career. And funnily enough, luckily enough, if you find a good mentor, you can transition into their practice. Yes. So that becomes a very important aspect. And a tip for the senior dentists would be to ensure that they start the transition planning well in advance and not wait until the practice loses its value over time. So those are two important things that I would want to end this podcast with.
True. I'm sure that this podcast is going to be listened by all the senior as well as those junior practitioners. It's so wonderful to have you here.
Thank you.
And thank you so much for coming in. I hope you enjoyed.
My pleasure. I loved being here. Thank you, Jaisal, for having me. Again, I wish you all the best in this podcast.
Thank you so much.
Follow all the other podcasts that are there.
Thank you so much. I'm sure we'll shoot a part 2 or episode 2 on some other topic which comes out on the comments.
Good. Okay. Looking forward to it.
Yes. Thank you so much, Doctor.
Thanks.
Please press like button if you like the video. Share it with your friends. Comment down your views about it or any special requests that you have and subscribe the channel. Thank you.